So today we have Dr. Fawad Mian. I wanted to talk to you a bit because you're a neurologist that has stood out in the industry for sure as being special and different. And I would definitely like to start our conversation today with that question, like as a neurologist, how would you describe your approach to medicine?
When it comes to approaching any patient, it's really just looking at the patient first and really diving in deep into what they have and what their problem is. So instead of just always slapping a Band-Aid on the problem, diving deeper into how they're feeling, what led them to the condition that they had. So for instance, if they've had some pain issues, what injuries did they have in the past? What activities are they doing? How does it limit them in terms of what they can do? That deep dive, for instance, in that particular case is something that we do in many patients. I think when we blend in an holistic approach along with that, it makes a huge difference. That can also be used in conjunction with even traditional medications too, as well.
It's funny because I know from the industry that you're someone that patients come to after they've tried everything. And it seems to me that you're far more than just a neurologist. You seem to wear many hats.
Usually a variety of different diagnostic tests to help arrive at a diagnosis or at least exclude a diagnosis. And then sometimes it may lend itself to doing some of their additional things. There are plenty of patients who love it when we go deeper with everything to know that we can get them to a place where they really want to be. Some patients also may want to simply not have to take medication at all. Many times we can get them a good result just doing simply the holistic treatments.
You have a unique setup there in your office. So you have Neuro Wellness MD, which is your medical office. And then in the same location, you have Prolo Healing Med Spa. So I think that's a really interesting combination. And it tells me that you don't limit your treatments to just what's covered by insurance. Like, how would you manage that across each of your enterprises?
The very first thing I would do is to look into what could be the etiology or what's the cause of the issue. So for some of these folks, we may do some laboratory testing, maybe do some imaging too as well, depending on what it is that it may be. After we've done the basic medical workup, then we might dive in a little bit deeper with some other additional diagnostic tests. But for those people also, for instance, when you kind of talked about ED, there are people who have already seen the urologist already, and they're looking for different alternatives. And so we've gotten that question asked a lot from a lot of folks who come in and, they're asked, is it a neurological issue or whatnot? And sometimes, even though it very well may be in some cases, we want to be able to offer things that are different out of the norm so that they can actually get a result for what they're looking for, not necessarily just taking a medication or a pill that may cause potential issues, which could be quite serious if they did take them. It's the same thing as you mentioned for hair. We would certainly, do some diagnostic evaluations, some lab testing to make sure everything looks okay. And there's not a medical reason why they're losing their hair. At least that's very discernible, such as maybe having low iron or having a thyroid problem, which are two very common things, for instance. For those people then who have already gone ahead and tried different topical treatments or medications, then we offer in other things such as PRP treatments to try to help stimulate that hair growth. A lot of times I've had plenty of patients ask me about these kinds of things, which aren't traditional neurology, but the amount of people that have asked me over the years consistently kind of amazes me. And so it tells me that their issues and their needs aren't really being met. And so that's why I've looked into other things to be able to help them.
PRP is also part of that vampire facial that Kim Kardashian swears by, right?
Right. Yeah. I mean, that's certainly one of the applications. I mean, it's used for a lot of different applications, but yeah, it can actually make a huge difference with the skin because it helps tighten and build up collagen and helps smooth the surface and actually helps with the discoloration too as well. So can make a huge difference for folks. And instead of being able to go through, some people may want like laser treatments, but those can be more painful. And it's simply like a great alternative, aside from some of the other treatments that you may be utilizing at home.
The thing I really love about your approach too, these are natural ways. So it's not like just injecting someone with a steroid.
Your body has a lot of natural things within it that actually can help heal and help make things better. And quite honestly, in many cases, they may just simply be better than drugs, surgery, or medications. I mean, we kind of look at the more of at the holistic approach. So being able to add in those things or those combinations of things sometimes can be the trick for a lot of folks too as well.
We talked about men's health. We talked about beauty too, and just anti-aging for the skin and things of that nature. What are the physical conditions you're most well known for treating? And what are your philosophies behind your approach that makes you so successful?
I would say one of the more popular common treatments is actually just related to pain. I may have folks come in because as a neurologist, we'll see people who commonly have like back pain, neck pain, but then they may have a shoulder issue, a knee issue, foot and ankle issue, a hand issue. Years ago, I had a foot issue, for instance, that wasn't getting any better. And I had gone to the podiatrist, the foot doctor, as what anybody would naturally do, got some orthotics, had some steroid injections. And after doing some more additional treatments from the foot doctor, at the end of the day, he was like, you know what, maybe we just got to shave down the bone. And so at that point, I'm not really looking forward to shaving down the bone or chopping anything out. That's kind of when I stumbled on these regenerative treatments, such as prolotherapy, platelet plasma, or PRP, and even cellular therapy or stem cell therapy, which is autologous. And these treatments made a huge difference for me. So within a few months of doing these treatments on my Achilles and my foot, I no longer had to wear the funny Frankenstein shoes that I was wearing. It was much easier getting up and down the stairs. I was actually able to go run after a period of time too as well. And that made a huge difference. So I didn't have to get anything chopped out. A lot of times surgery may not always be necessary, but for some people, they feel like that's the only resort that they have. So there are certainly alternatives to that too. Just some of the other treatments, that we do offer, also the emerald laser. What happens with a lot of people is when they don't feel good about themselves or their appearance or whatever it may be, inevitably that also affects how they feel internally and physically. So people can manifest more pain, more issues. So being able to not only physically make you feel better, but at the same time also helping you to look better, and also dropping some fat around the abdomen and also a little bit of weight, that can make a huge difference in terms of how you physically feel in the long run. So we definitely want to make people look at it and feel better. And that's part of the Polar Healing Med Spa that you had mentioned.
I was really intrigued too, because there's no downtime, there's no pain in the process. How would you compare that physiologically to something like cool sculpting?
The difference between this and cool sculpting is, number one, you're not going to get the pain. You're not going to get the stick of butter that you could potentially get with that. And the emerald laser actually has a greater benefit in terms of lost inches. So for instance, if you take the abdomen or the circumference, on average, people would lose about 4, maybe 5 inches, some people more and some people less, depending on also their physiology and what they're doing physically too as well. And with cool sculpting, people don't usually get up to that much in terms of inches lost. So it makes a huge difference, but it's also not painful at all. And the way that it actually works is that it actually helps poke holes in fat cells so that it can kind of leak out. And it's taken out through your lymphatic system. So through hydration, obviously keeping a healthy lifestyle, people can get the results that they ultimately want and ultimately feel better, certainly in terms of how they're wearing their clothes or how they look, and obviously how they physically feel better too as well.
By the way, I also noticed on your site that you have a book that you published, and it was about your life and your pain and how you even were able to build up your knowledge base and self-treat.
I did write a book, and it's on Amazon. And it's more of, that's not so much that I'm selling books per se. It's more of just kind of going over, well, what did I experience and how did I get to this point where I started doing these other alternative treatments?
Mm-hmm.
And so in that case, the getting to pain-free without drugs or surgery, essentially I was talking about kind of the issues I kind of mentioned a little bit with my foot, my ankle, my shoulder, and all of that, and seeking out these alternative treatments. And so we actually use it to as information for patients too as well. So at least they know that I'm somebody just like them. I had kind of gone through the same thing similar to them. And that makes it obviously a little bit easier to have a rapport with other people and understand these things. At the same time, it also gives them more information on what these treatments are. And so I think it's like a good starting point for some people who don't really know what this is, or they're going through the websites and looking at things. So it actually ended up being a #1 seller on Amazon too as well. It was something that I did enjoy writing, and I wrote it a few years ago. And I feel that, there have been plenty of patients that feel like they've benefited just by reading it and understanding that, yeah, there is an alternative to drugs and surgery.
You have your medical office, which is Neuro Wellness MD, and then you have Prolo Healing Med Spa, both in the same location. Did you do this just for your love of more of your holistic approach and to make it easier for the patients to understand the difference between a prescribed medical plan versus like alternative therapies too?
You know, always want to give people the choice of what it is that they want to do, whatever specific reason, whether it's, pain related. I did want to give them the alternative. So they do have those options. So just being able to do these holistic approaches are definitely, it's something that I'm definitely very passionate about, and something, honestly, like I said, I stumbled across this stuff a long time ago before it became a little bit more popular as it is now over the last several years, or last 5 years or so. Being able to integrate all of that and then giving those folks those alternatives definitely allows me to do both with folks too as well. So they don't feel like they have to do one thing or the other. They do have their options with them. We offer different packages for different treatments, whether it's the laser or it's for these issues for pain, for instance, like with platelet-rich plasma, or if it's a skin-related issue. And those memberships are things where they can actually get frequent treatments with that too as well. So for those folks who are a little bit more gung-ho than the others, they certainly can get their share of treatments and get to the desired result that they really want and what they want to achieve.
What's most important to you when you're with a patient, and how do you measure patient care success?
Patient care success to me is really just how are you doing with the treatments that we're doing, and how do you feel? And ultimately, the real question is, were you able to get back to your life? Were you able to get back to the things that you love and enjoy to do? And, do you feel really good about that? And so when I have a patient come in and they're smiling and they say, hey, you know what, I feel way better. These headaches are better, or this pain is better after those treatments, or I've lost some inches off my waist. That's very rewarding. I did have a patient not too long ago who came in, and she had some chronic dizziness, and she wasn't getting anywhere. She had been to several ENT doctors, and she had tried medications, and she just wasn't getting anywhere. And she was finally frustrated. She was like, you know what, I'm just going to see the neurologist because nobody else can figure out the problem. So in this case, we found out that there were some other issues going on with her neck too as well. And she felt significantly better within about a month or two. That was something where, she felt great, and that she was actually able to do more of what she wanted to do too as well. And, she was obviously able to share some insights with a good review. And, I measure that success because other people know about what our experience was, and at the same time that actually led to other folks coming in also looking and hopeful and trying to resolve their problems and feel better too as well. So that to me is definitely a marker of patient success, and people feeling really good about themselves too as well.